On her way home, the sanitation worker suddenly saw a pregnant woman bleeding heavily. She quickly approached and tried to rush the woman to the hospital. However, the bleeding wouldn't stop. She then asked a passerby to help hold the woman who was about to give birth. Without hesitation, she took out an old silver needle from her pocket. She swiftly inserted it into the woman's head. In less than 3 seconds, the bleeding stopped. The people nearby were amazed and started calling her a miracle doctor. With the help of bystanders, the pregnant woman was soon sent to the hospital. At that moment, the hospital director, who had just been at a loss over another patient, suddenly noticed the silver needle. It was the legendary 9-turn resurrection needle, long lost to the world. The reason the woman became a sanitation worker was because she had been wronged. She had once taken in an ungrateful apprentice. Her apprentice, who had learned just a little, had climbed to the position of department head in a hospital. But instead of being grateful, the apprentice dismissed her, even neglecting patients under her care. The woman, swallowing her pride, begged her apprentice to let her treat just one last patient, but the apprentice scorned her, saying she couldn't even use a stethoscope and was outdated. She called the woman a parasite in the department, living off others. Without further discussion, the apprentice kicked her out. The patients in the waiting area watched and whispered as the woman packed up her things. She left in silence from the job she had worked her whole life for. Without her discipline, the apprentice began to recklessly prescribe expensive treatments. For a single visit, they charged patients tens of thousands of yuan. The apprentice even justified it by claiming the woman had used outdated medicines, which were ineffective. Patients, afraid to argue, had no choice but to spend months of savings on supplements. Meanwhile, the director of the provincial hospital was struggling with a critical case. The son of a former billionaire had been pierced through the abdomen by a steel bar. The hospital's experts said surgery was impossible, as removing the bar would cause massive bleeding and lead to certain death. The wealthy father threatened the director, saying that if his son died, he would withdraw all his investments in the hospital. In desperation, the director realized only the hospital's miracle doctor could save the situation. Coincidentally, news of the woman's retirement just came through. The director immediately sent someone to bring her back to the hospital as the miracle doctor. Meanwhile, after returning home, the woman still couldn't rest. She kept studying medical techniques, determined to improve. But because she had spent her life dedicated to curing others, without pursuing fame or fortune, her family was struggling financially. She hadn't even earned enough for her son's dowry, which upset him. Reluctantly, the woman returned to her sanitation job. One day, while cleaning, she saw a pregnant woman collapse from excessive bleeding. Seeing the urgency, she knew they had to stop the bleeding immediately to save both the mother and the baby. She quickly took out her silver needle and reassured the woman that she would help. Afterward, she rushed the pregnant woman to the provincial hospital. By chance, she ran into her former apprentice in the hallway. The apprentice, seeing her in her sanitation worker uniform, immediately mocked her. At the same time, the hospital director was anxiously searching for the woman. When he saw the silver needle in the pregnant woman's head, he realized it was the 9-turn resurrection needle. He learned that the woman who had brought the pregnant woman in was a 60-year-old lady. He guessed that this was the miracle doctor they had been looking for. 3 minutes later, he found the woman arguing with the apprentice. He realized she was the one he had been searching for, the legendary white miracle doctor. Excited, he explained the situation